There's some really strange plastic surgeries out there. I'm a real plastic surgeon, and on this video, we're gonna count down 5 of the strangest. Well, Cinderella had to find the shoe that fit her foot. But what about changing your foot to fit your shoe? Cinderella surgery is cosmetic foot surgery that is supposedly made to make your foot look more attractive and fit a shoe better. One way this is performed is by shortening a long second toe. When the second toe is longer than the great toe, this is called a Morton's toe. And way back when, this was actually considered a sign of nobility. Well, unfortunately, a long second toe can interfere with fitting into a certain type of a shoe. So some doctors are actually removing bone from that second toe as a way to shorten it and to give them a Cinderella procedure, like you see in this video right here. Now, in a Cinderella procedure, sometimes you combine shortening of that second toe with other procedures, like removal of bunions and actually thinning of the foot itself. And some podiatrists are even removing fat and skin from the toes to make the toes look thinner. They call it, believe it or not, tobesity. Now take a peek at this video that this podiatrist shows a before and after of treating tobesity by making the great toe smaller. Now my issue with this, I don't perform these procedures. I've actually never seen them perform because I'm not a podiatrist. But are we creating a problem cosmetically that was never really there in the first place? I mean, is it really necessary to change the shape of the foot to try to fit a certain type of shoe, or are we just going overboard with cosmetic procedures? These are silicone implants, but for what body part? I'll give you a hint. These large ones are for somebody like myself, and these tiny little ones are for somebody like my arch enemy. So these are silicone testicular implants. And these are oftentimes used when men have had their testicles removed from, let's say, cancer surgery or from injury. They can also be used in transgender men, and some people have these used for cosmetic purposes. Now, the testicles can atrophy. They can get smaller as you get older, and some men want bigger balls. The other group that sometimes wants these are men who've been on anabolic steroids. And we all know that if you go on steroids, it can actually shrink your testicles. So how does a surgery work if you already have testicles, you just find that they're too small for you, and you want bigger balls? Well, you don't remove your original testicles because that could cause problems with your hormones. But what you can do is take these silicone testicular implants, put them inside the scrotum next to your original testicles, and it will sit next to it, and usually you don't see that you have 4 basically balls inside your scrotum.
All right, it's getting crowded in here.
So here's a question I would love for you to answer in my comments. If you had really, really small testicles, or maybe your partner did, would you have this procedure done or encourage your partner to have it done? Is it really that important to have bigger balls? Can you transplant pubic hair to the top of your head? Well, this is a question that all hair transplant experts are asked at some point, and the answer is yes. You can take pubic hair and you can actually transplant it to the top of the head, and it is done very rarely. Now, there must be some caveats to this procedure. If you've got really curly hair, then you put a pube on top of your head and it grows, you may not notice that it's a pube. However, if you've got straight hair, then that curly pube may look a bit odd. And so in these situations, you can't just go ahead and put a ton of those up on top of your head. You want to try to intersperse them with the normal hairs so that they don't really stick out a whole lot. And the other thing is that if you are putting pubes on top of your head, you don't want to put them right along your hairline, because if you've got straight hair, but you've got that curly pubic hair coming out, or a bunch of them, it could really look not so good. Now, one benefit of putting pubic hair on top of your head is that you may not need to graft as many hairs, because that curly hair tends to look like it takes up more space than a single straight hair. Now, you can also do the opposite. You can transplant hair from your head to the pubic region. That would develop the problems that are the opposite of what happens when you put pubic hair to the top of your head. You may find that the hair that's transplanted from the back of your head to your pubic area may end up looking straighter than you would want it to. And another use of pubic hair transplants is actually the eyelashes. Take a peek at this video of this surgeon showing his before and afters of a procedure where he's literally transplanting pubic hair to the actual eyelashes. And the important part of this you got to consider is that those pubes are going to continue growing. So you do have to cut them, unlike normal eyelash hair that stops at a certain point.
You can expect a more natural looking result compared to conventional method of taking hair from the back of the head.
And can you imagine if you had pubic hair growing out of your eyelashes and you decided you weren't going to cut them, how they might look like several months after they have had a lot of growth? That I would really like to see. Well, this is an odd operation performed mainly in Japan as a way to alter your fortunes. So we all have lines in our palms that we can get our palms read, and it tells us, let's say, if we're going to be very successful in life, if we're going to get married, if we're going to have health issues and things like that. And whether you believe it or you don't believe it, there are some people who are taking their palms in their own hands. This is an operation that takes about 10 to 15 minutes to perform. The recovery takes about a month. And what doctors are doing is they're taking basically cautery, a cautery blade, and they are cauterizing longer and new lines into the palms of their patients. And the idea in general is that if you alter your palm lines, can it alter the course trajectory of your life? And interestingly enough, reports show that men who are having palm line surgery done do it to change the prediction of the course of their business or their professional life. Whereas women who have palm line surgery done, in general, have it to change the course of their love life and their relationships. Now, I don't recommend getting palm line surgery done. Obviously, number one, it's unnecessary, but number two, the hands are so important. And if the surgery is done inappropriately, you can get scarring around the tendons of your hand, you can get an infection, and you can even damage underlying nerves, which could create chronic pain for the rest of your life. So what is the number one strangest plastic surgery over the last 20 years? So take a peek at this video of people undergoing bagel head procedures.
No, these aren't auditions for the next Star Trek movie. This is what is known as the Bagel Head modification. I'm not kidding. It started in Canada and eventually spread to Japan. Individuals actually inject saline into their foreheads and then use their finger to make a hole in the middle so that it resembles a bagel. Fortunately, it's not permanent since the saline gets resorbed by your body and then eliminated through your urine. And no, it does not come with cream cheese.
This was once again made popular in Japan of all places. I don't know why they're doing all this crazy stuff in Japan, where you actually inject saline into the forehead to make it stick out, and then you take your thumb and push in the middle of that saline basically lump, making it look like you got a bagel head. No, I don't recommend doing this procedure. There are risks of infection with it. Not a whole lot of other risks, honestly, but it's just kind of silly. But you know what else I think is silly? Removing your ribs to make your waist look thinner. I react to a video right up here of somebody who's doing that. They're actually removing parts of their ribs so that they can contour their body more. And there are several other strange plastic surgeries in this video right up here. Take a peek and remember, as always, to eat real food, use clean skincare, and auto-rejuvenate before you operate.